Hi, I'm Lisa Hayden with Channel 6 Central Kentucky TV, community focus on Washington County. And I just love having our Washington County people here. And so I'm happy today to have with me, and for the listening audience, Harriet Sims Boone. Welcome, Harriet.
Thank you, Lisa. Glad to be here.
Lifelong resident of Washington County.
Yes, ma'am.
However, Harriet, I know you are employed with the Home of the Innocents in Louisville
Yes.
as
I'm the Associate Director of their Therapeutic Loving Foster Care Program.
Therapeutic what?
Loving Foster Care.
Loving Foster
Yes.
Care Program.
Yes.
Well, that is certainly a program that is important, I know, to Washington County, because having been a social worker that I've mentioned before, there were times we placed children there at Home of the Innocents, and there is a desperate need, as we all know, for foster parents.
Yes.
So these are children that, what, Harriet?
Well, children that are in therapeutic foster care are children that generally have emotional and social needs that are higher. They may also be what they are called medically complex, so they may have medical needs as well. So they are considered a higher level of care. And so our foster parents, we train, have more training, they have more ongoing training, as well as our program provides more services to our families. We have staff 24/7 that are available to the families for support. We have therapists on staff that provide therapy to the children. Every family has a family consultant, which is kind of like a case manager that does weekly contacts with the family so that they have additional support. And that family consultant coordinates with the school, with the state social worker. If there's court, they go to court with the family. They also are in contact with the biological family if the biological family is involved. So with therapeutic foster care, as opposed to traditional foster care, there's much more support involved, not just on the child side, but also on the foster parent side.
Yeah. Gosh, I wish my foster parents had had those kind of services in the day. So now, Harriet, okay, first of all, these children who are in your care are committed to the state.
Correct.
Through the Cabinet for Families and Children.
Correct.
And the court system, and then the social worker there refers the child to placement for a placement with you all.
Correct. Yes, the state contracts with us as a private child care provider, and then if they can't find, either if the child is leveled, we also have basic children or traditional children in our program as well if there's not a state home available. So the state will refer children to us, and we try to find a home. We try to match them. All of our families have the opportunity to decide, what kind of children they want. We don't just say, oh, you have to take this child. They can say yes or no. And so they'll refer children to us, and we locate a family that, we think is the optimal family for them, and then we place the child in that home. Mm-hmm. But once the state refers them to us, we become the caretaker and the care holder of that child.
Oh, I see. So then the state is no longer involved.
They're still involved. They still are the overall guardian, but
right.
We are able to do like medical care for them. We're able to do educational, like enroll them in school, able to take them to the doctor.
So the case,
things like that.
What did you call them? The case
the
coordinator?
Family consultant.
The family consultant. So they're kind of in charge of the case
right.
or that child.
Right.
And then they're the ones that coordinate those services.
Yes.
And you said in addition you have so the family coordinator could say, okay, we need therapy for this child, or normally I suppose they are in therapy since this is therapeutic foster
Right.
care.
Most of our children are in therapy, and we have therapists on our staff that provide that therapy.
Yeah.
And we do in-home therapy, we do in-school therapy, we have in-office therapy. We really try to do a rounded therapy so that you're doing a holistic view. Seeing the child in the community, in the home, is very important. And then we also try to provide family therapy for the foster parents so that they have that service, because it's a difficult,
a better understanding of the child.
Yes,
and the child's needs. And
it's a difficult job.
Right.
And if the biological family is involved, we will provide services for them as well. So it's a very holistic approach.
Sounds really good. So now, Harriet, you are a therapist, of course,
Yes.
and licensed clinical social worker.
Yes.
But now you are over those services. Then you're just in the administrative.
Right. I'm kind of like a treatment director.
Right. So you're not providing the therapy to these children individually,
Right.
like you used to do, and
Right.
you were so good at.
In the day.
So then now these children, so they're placed in foster homes.
Yes.
I believe here in Washington County as well.
Yes.
You recruit.
Yes, we recruit. We do services. We recruit in Washington County, Marion County, Nelson County. Christina Knopp is our recruiter in this area.
Who is that?
Christina Knopp.
Christina Knopp.
Christina Knopp.
Okay.
And we provide recruitment. I mean, she can come out and do training in homes. We can do trainings. We'd love to do like community trainings where we come out to a church or like a group and do trainings if we could get groups. And we do trainings around people's schedules. Whenever. We don't have set groups of you have to come on this day and this time. We do it according to what people's schedules are.
Wow, I'm impressed.
It's not easy, but we really, we
try to.
We want the families. We want to accommodate, and we
Exactly.
need the families. And so you have to meet the need of what is
Yeah.
out there. Everybody's busy.
Yeah.
It's a crazy busy world, and so in order to get families, you have to accommodate them.
Yeah. So is it a long training process?
It takes about 9 weeks.
Mm-hmm.
There's 9 weeks, 3-hour sessions. And then with that, you also have to do, there's, of course, tons of paperwork.
Oh, yeah.
But a lot of it is like gathering things together. You know how you have to have birth certificates and marriage license, and if you've been divorced, you have to have your divorce paperwork,
Mm-hmm.
and you have to have car registrations and a lot of it is things that you have.
Right.
It's just getting them together and getting them to us. So it's a
Yeah.
lot of gathering data, and you have to fill out like paperwork on your history, because we have to write what's called a home study, so that when it comes time for a child to come into your home, we have to send that to the state worker, so that they can read it and be like, yeah, this is a good place for this child. They want to know who you are.
Right. Right.
So we have to have a really good background on you and who you are.
Yeah. And of course the regular checks, such as criminal record checks.
Correct.
And
We
that.
do 3 background checks.
Mm-hmm.
You have to be 21 years old.
Okay.
Married, single. We don't. A religious affiliation doesn't matter. Sexual orientation doesn't matter. We love everyone.
Yeah.
We want everyone.
Yeah. Because there's a child out there for you.
Yes.
Normally, that's going to fit
Yes.
your situation.
Every child has different needs.
Right.
And so every adult there's adult out there to match every child, and
Yeah.
we know that. So we want
Yeah, you
all
want a
different
variety
kind
of
of
homes.
families.
Exactly.
Yes. Our new logo is a child that is like a rainbow of colors,
Yeah.
because that's what we need.
Yeah, certainly. Well, now, how many children do you have in your placements?
In our program, we have about 65 to 70. We're not a real big program. We're growing. There are 8,000 children in the state's care right now.
Oh my gosh.
Yeah.
That's
8,000.
unbelievable.
It's unbelievable. And they are either in residential programs or in foster care. we are, looking to expand. We want to get bigger. We want to have more families. We don't want to get great big, because when you get great big, you kind of lose that family. Home of the Innocents is a very
family-oriented
Yes.
Agency.
Yes.
Yes.
But we have about 65 to 70, kids in our program right now. We're really proud of. We have a lot of medically complex families. Of course, we have the pediatric convalescent unit in Louisville, and they've always done a lot of medically complex things. So it's kind of a specialization that they have. So, but that's not all
where
we
the
want,
children come to the facility, to the home. If anyone's ever seen the Home of the Innocents in Louisville, it's a huge,
it's a beautiful facility.
beautiful
It's a beautiful
campus.
facility. Yes.
And I don't even know what all it has on its campus anymore, but where you had the medically challenged, or children with medical problems.
Correct.
And is that the pediatric?
Yeah, the pediatric convalescent unit is for children who, basically, a lot of times they can't be taken. They're still in the care. Most of them are in the care of their parents, but they just have such severe medical needs that they need to be taken care of, out of the home.
Right.
And so they come and live there. So we have the pediatric convalescent unit there. We also have multiple residential units there.
And are those, the residential units, are those for children that, I suppose you might have one home residential unit that's for children that have, behavioral and emotional disabilities?
Yes, those are for children who are
all
a higher level of behavioral and emotional, and those, we have little children up to teenagers. We also have a unit that is for teen parents that have, their children there, and they're learning how to parent them so that they can, take care of them outside of the home. We have independent living programs where, they're like learning to become independent.
Or getting ready to become independent at
Correct.
age 18 or
Right.
21 and up to 21, I guess, who are wanting to go out on their own.
Right.
And so they need those independent living skills.
And then we have a new, not new, but a newish program called Open Arms that is like a medical facility that has doctor, dentist, vision, psychiatry, psychology. So like you can come and like bring your child and get everything done in one place.
And you mean
pharmacies there too? It's all like
a child that would live there at Open Arms?
No.
But just come for the
for
some medical evaluations?
Yeah, like if you had a child that like needed to get a physical done, or like needed to see a therapist and a psychiatrist, and also needed to like get their teeth cleaned, they could come and get all those services in one building.
Wow. Well, that's a good idea.
Yeah.
Now, so can parents, you have to have a do you all have to have a referral? Can it be self-referral? Can a parent just come and bring their child? Or,
For what?
Well, for Open Arms or
for Open Arms, they can just call and say I need to see a doctor, and then they would get an appointment, or I need to get I want to do psychological testing, and depending on what their insurance is or whatever, they can. The Open Arms is more of a kind of separate, it's like an outpatient
kind of
service.
clinic. Yeah,
it's like a clinic.
Okay. So, but it's on the grounds there of Home of the
Right.
Innocents. So, but now all the kids that are in placements, the
Yes.
foster children, they are referred through the Cabinet for Families and Children?
Not all of them. We do have one program that is a grant waiver program that is for like parents that might have to go to a substance abuse, like if they have to go in for 28 days of treatment, or if they maybe have to go in the hospital for like 2 weeks of surgery and they don't have anybody to take care of their child, or they don't have, and they don't want them to go in the state's custody, they can request services for this, and they can come into our care for just
Short
a short
term.
term.
Kind of like respite care or
Yes.
something, where they're just.
And this grant allows for them to assign guardianship over to us for just a short period of time. And then when they're out, it goes right back to them. So they do come into our teaching foster parents take care of them, but the state is not involved.
I see. Right.
So that's a
Right.
really not. It's
Yeah, that's a nice program because
Yeah.
that prevents. That's a preventative program
Yes.
to keep families from their children ending up in state's care. Then.
yeah.
So you kind of head that off by
Yes.
providing those services needed on a
Yes.
short-term basis. Very good.
Yeah, I believe that's called Project Safe Keep.
Okay.
And it's available for anybody in the state. So like if a parent needed to go get rehabilitative services or something, they can contact the home. If they didn't have anybody to care for their child and they didn't want to have to take them into the state's care, they could contact us and we would be able to take care of their child until they were. It's a short term.
But still, it just may be all that they need.
Mm-hmm.
And then with the young mothers or can they be pregnant and go into that one?
Yes.
And then they have the baby and then
Yes.
they stay there and learn to take care of the baby.
Yes. Yeah, we frequently get emails on the mother's in the hospital having the baby. We need someone to go stay with her, and we have to volunteer because
that?
when they're in the hospital, we have staff with them, at all times. So yeah, they can be pregnant and go in.
And so, do they have to be in state's custody, or?
I believe they are. I'm not as familiar
Okay.
with that program, so
Okay.
I'm not sure.
Uh-huh.
But I'm pretty sure they have to be because we have to go stay with them. So
Yeah.
we wouldn't have had to stay with them
Yeah.
if they weren't in state's custody. So yeah.
So now, Harriet, then your focus is getting homes for children in the state's care, children that have therapeutic needs, such as emotional and behavioral disorders.
Correct.
And maybe for those that might not understand what that is, perhaps you could elaborate on that a little.
Okay. A lot of our kids, trauma is kind of the big thing now. They have been possibly sexually abused, physically abused, they've been neglected, and so they obviously have had trauma in their life. And so that plays out as, they might be verbally aggressive, they might be depressed, they might be anxious, they might be diagnosed with ADHD, they have some type of emotional diagnosis. And it can be, not super severe. It can be, we have kids that are, they level kids, like, a basic to a 1, 2, 3, 4, 5. The therapeutic kids are a level.
As regarding the
severity
of
like a level
the behavior.
A level 3 is like where therapeutic starts.
Okay.
So we have 3, 4s, and 5s are what they consider therapeutic. So our kids, usually, most of our diagnoses, have like attachment disorders where they have a difficulty at, connecting with people and trusting people, and so, there's lots.
And that's
of
certainly
tantrums.
understandable,
Absolutely,
isn't it?
Absolutely. So there's lots of tantrums. A lot of it is very normal child behavior. It's just kind of to an extreme.
Right. And it's something that you work on with all these supportive services
Yes.
for the foster parent
Yes.
and the foster child.
Yes, and that's part of being a therapeutic foster parent is, you do additional trainings. We have support groups every month. We have, webinars that we send out. We have, all these additional support so that you are able to, do more and learn more so that you are able to be, we actually call our foster parents teaching parents because you're teaching these kids how to be different. We're not trying to fix them. We're trying to heal hurts. We're trying to, nurture them back to being, a more stable child.
Yeah. Yeah. So some foster parents, you might have a child a few months, 3, 4 months, but it's possible you could have them, how long?
I mean, we have a lot of foster parents that adopt the children,
Oh,
you know. So, you know, we do have adoptive homes. So,
oh, so do you all do the adoption service as well?
yes, we do.
Okay, so if a child came into foster care and their parental rights were terminated, then you all could, and the foster parents were interested in adopting, you could provide all of that, all in one place.
Yep.
That's great.
We do it a lot.
Yeah. So if someone was interested, Harriet, in becoming a foster parent, I mean, so you all would come and make visits to Washington County, making sure that a child was doing okay here.
Yes.
And coordinating those services and
Yes.
care.
Yes.
I see. And of course, you know, with Central Kentucky TV, this is aired in Marion, Nelson, and Washington counties. So that is good because you serve that area.
Yes. And we have an office in Elizabethtown. Our office that serves this area is in Elizabethtown.
Okay.
So.
Okay. So if someone was interested in becoming a foster parent, how would they do that?
They can go to homeoftheinnocents.org, and there is as soon as you go on the website, there is a thing that says, "Are you interested in being a foster parent?" There's also, I need to find my phone number.
So homeoftheinnocents.org. And there's a place right on there if you want to be a foster parent. Now, and the foster parents get a monetary fee for taking care of these children with therapeutic needs. So they, and that's a higher rate of pay per diem.
Yes, there is a per diem, and it's based on what level the child is.
Yeah.
And that is to help with, dealing with the behaviors. It's to help with cost. It's to help with, some of these kids do tend to destroy property. I'm not going to lie. They do tend to, be more difficult. They're hard on clothes. They're hard on clothes. So, that fee it's not meant to be income.
Right.
Sometimes people will call and be like, "Oh, I need to have income." You have to be financially stable to do this.
Right.
You have to have a car and have transportation to be able to do this. It is not meant to be, your work.
Right.
But, you do get, funds to be able to take care of these children. And we recognize that, a lot of these kids are difficult kids. And so, the per diem is, it goes up per level.
Right.
But the phone number is 270-300-7831.
270-300.
7831.
Oh, 7831.
And that's Christina Knopf's.
Christina
Recruitment.
Knopf's.
Yeah.
Okay. Is she in the Elizabethtown office?
She's in the Elizabethtown office, yes.
Okay. So that's good. So if a parent, and with that, with that per diem, that pays for the child's clothes, that pays for your increase in electric bill, your increase in groceries, all the daily expenses you would incur with a child to begin with. And of course, like you say, transportation fees if you need to take them to the doctor. And
the children also have a medical card, so you don't have to pay any medical fees for them.
Yeah.
So.
Yeah. And I guess if they wanted to be in things at school, you would pay extra.
Yeah, that would be expected to be paid for out of that per diem.
Oh, out of that per diem? Okay. So, but I know that you're not going to make any money, but you're not going to lose any money either.
No, it's a very generous. I mean, I think it's a very generous, amount of money for the children.
And we need foster parents.
Yes.
That are going to care and love these children.
And with Christmas coming up, I mean, the home is amazing with what they do. They get every child sponsored. And even if you have foster children in your home and you have your own children, they make sure they sponsor the biological children as well. so that they don't feel like, why don't I get taken care of? So every child that is in a therapeutic foster home, the home sponsors and has Christmas gifts for.
All the children in the home.
Yeah, because I mean it's a huge strain at Christmas time.
Yes. Yeah.
You know, so we know it's a really difficult time, so they sponsor the whole family.
Yeah. Well, that is great.
You know,
yeah.
And and they have parties and Santa. I mean, there's it's from what I understand, Christmas is like like December. Every day in December, there's it's Christmas all December. So yeah.
Oh, that's great. That's great. Well, I know that these are children that have come from very difficult situations, and your heart goes out to them because they have suffered so much, and you just want that child to be well.
Yes.
And to be healed. And so I know that you need good, loving foster parents to do that. And so I certainly hope by your being on here today, Harriet, that that we will have some foster parents that some listeners out there that would like to become foster parents. And so and I want to ask you again to give out that information, and if there's anything else you would like to share.
Let me get the number. It's 270-300-7831. And again, you can go to the website as well, homeoftheinnocents.org. And there's additional information on the website if people, if you don't want to talk to someone directly, you can go on there and fill out a form and, just get information. I actually am a foster parent, and I have been a foster parent for the state and a therapeutic foster parent, and part of the reason I became a therapeutic foster parent is because of the additional support and because of the additional, need. I almost feel like that every child is a therapeutic foster child. When you take a child away from their home, regardless of what has happened, regardless of what's going on, you're taking them away from everything that they know. And so how can they not need additional support? How can they not need all this other, services? So, and as a foster parent, even as I'm a parent, I'm a therapist, I need the support.
Yeah.
So, it just, to me, it just makes sense.
Yeah.
DCBS does a great job, but it's, the state is just not able to do as much. And so it's very fortunate, I think, that we have programs like this. And it's just something that is part of me and part of my heart. So I hope that people will do it. And if you can't do it, then, and people that can, then tell them about it, because it's a wonderful program. And the Home of the Innocents is just, I can't say enough about it. It's just an amazing organization.
Yes, the Home of Innocents has been around a long, long time, and they have provided a lot of good services. And they are always in need too, in case you can't be a foster parent. They use volunteers.
Yes, you can volunteer. If you need a job, they're always looking for great people to work. If you want to work with kids, and I mean, a lot of people drive to Louisville for other jobs. They always need people to work with kids. And, if your heart is in it, then, go on the website and apply for a job. It's a great place to work.
Yeah.
It really is an amazing place to work.
Well, Harry, I didn't know you were a foster parent. And as a foster parent, that just shows that you can be a foster parent and be employed. I mean, what I'm saying is, foster parents think, well, maybe the foster mother needs to be home, in the home all the time, but
no.
You work outside.
It's not easy, but
no, it's not. And as anyone who raises children in and of itself, who's a working parent knows, it's not easy.
No, most of our foster parents do work.
Okay. So then, and if they needed help with daycare, there's some daycare subsidy, perhaps?
No, that's with therapeutic foster parenting, there is not, and that's part of too why the rate is
as high as
usually
it
higher.
is.
Yeah,
I see. So they can use money out of that per diem to pay for
Correct.
daycare. Okay, good to know. So, okay, and that's really good to know about you, Harriet, too. That that there's obviously working parents and people that have big hearts that want to give to a child. So thank you, Harriet,
Thank you,
for
Lisa.
being a foster parent and for being on here today to encourage others to do that.